Hello everyone, Dr. Alex Vasquez here with video number 2, kind of reintroducing the antiviral strategy for this year, 2019. Today's conversation is going to focus on the amino acid L-cysteine, and the structure of this presentation kind of includes the following background. I looked at about 250 articles, 60 of which were specific to antiviral or immune nutrition, and I worked on this for about a month, and at this point I have to say that it's at least good enough to present, even though it doesn't say everything that I want it to say. It's good enough and time to move on to the next topic. So I'm going to move through this at a pretty quick pace, as you might be able to tell. More information will be available on my website, inflammationmastery.com/antiviral. So the first question is for you, the listener, or if you're reading the transcript, you would be the reader. What do you know about cysteine, acetylcysteine, or NAC? I suspect that most medical doctors do not know the following information, or at least most of it. So what are the dietary sources of L-cysteine and acetylcysteine? Biochemical synergists, these would be primary, secondary, and tertiary. Clinical synergists, of course, that would depend on the clinical condition that we're trying to treat. But in this case, like I've already said, we're going to focus on viral infections. So what 4 other treatments could you use with acetylcysteine to help it work better? We could also name at least 4 other clinical uses of acetylcysteine, along with, of course, its contraindications and adverse effects specific to oral administration and intravenous administration. At that point, we should be able to then discuss risk-benefit ratios and cost effectiveness. Let's look at some of those questions in a different way here. Basic information about L-cysteine is that it is, of course, an amino acid. It's a component of glutathione. It's mucolytic and is also FDA approved, not only for its mucolytic effect, but also as a remedy for acetaminophen or paracetamol overdose. I would consider that really basic. I suspect that most, even medical doctors, would know that. Some more advanced information. It's a conditionally essential amino acid, meaning the body can make cysteine from other precursors, including other amino acids, but it's conditionally essential, which means that in some cases we need to provide the amino acid, and if that's true, then we would also need to know at what level or what dosage we would need to provide it in certain situations. It's considered the rate-limiting amino acid for glutathione synthesis, but you'll also know if you read the research that all of the amino acids that constitute glutathione are considered rate-limiting. So one would then need to understand how those amino acids interact one with the other. As I said before, it's mucolytic, mostly via the inhalational route, but we do see significant benefit with oral supplementation as well. As I mentioned before, it's a remedy for liver toxicity due to acetaminophen or paracetamol overdose. Usually that's in the setting of a suicide attempt, and I've given you some dosages here. Intravenous is equivalent to oral therapy if started within 8 hours of the poisoning. After 8 hours, intravenous administration provides greater benefit. It's catabolized in the liver in response to interleukin-6 mediated inflammation. So anytime we see a patient in an inflammatory state, we can be pretty sure that if their CRP is elevated, we know that's a reflection of interleukin-6 mediated inflammation, and we could therefore reasonably hypothesize that they are catabolizing their cysteine in the liver, usually for the sparing of glutamine, and I'll discuss that more later. By this stage of the game, all healthcare providers should be aware of the neuropsychiatric benefits of acetylcysteine and how it modulates glutaminergic neurotransmission. I'm your host, Dr. Alex Vasquez. You can see my information here, and on the following page you can see my notices and disclosures. When I talk about dosages in this presentation, I'm only talking about adult dosages. A lot of the information that we're going to discuss right now is contextualized within my largest textbook, which is Inflammation Mastery 4th edition. You can find out more about this book at various websites, including inflammationmastery.com and ichnfm.org. Inflammation Mastery